Boss, Abloma. My name is Louis Abuga from Birth and Deaths Registry. I'm a volunteer. My job is to go to the communities where they don't have hospitals or health facilities. And I work with the nurses wherever they meet their people in the community. Previously, we were using forms to register, and right now, I started using the tablet. The tablet is good. We use mobile internet. If you are using the forms, maybe you are going and then it gets missing or something, but here you just straight away send the information.
At the moment, it takes about, on average, more than 6 months from the time a birth was registered to the time it was entered into the database. With this new system, we can actually do that in less than 2 minutes.
Birth registration is a universal right for all children. And you need this as a legal identity, as a legal proof of who you are and where you belong. Now, all children need to be registered, but the child who needs it the most is the child who is at risk of getting into, for example, child labor or otherwise being exploited, or the girl who is at risk of getting married. Now, she needs a proof of her age to be able to legally stop it. Last year, we know that almost 500,000 children were registered, but this only accounts for about 65% of all children who were born in the country.
This idea came up that we could take advantage of technology, mobile phone, tablets, and the rest. We started the pre-pilot in December 2015 in 11 communities and 4 hospitals in the Greater Accra region.
UNICEF, we are very proud to be associated with this initiative of introducing a new automated system for registration. One of the challenges that we faced when we started to discuss about this with the Birth and Deaths Registry partner was to find a telecommunicator provider that was willing to also partner with us. So we're very happy also that Tigo, Millicom, has come on board.
As Tigo, we're very proud to say that we are providing connectivity to the entire project. We're also providing data bundles and tablets to the volunteers from Birth and Deaths Registry. As a mobile operator that has been in this market for 25 years, we obviously have coverage in most areas in the country. This project exemplifies how big corporate companies can make really sustainable social impact. But for me as a mother, it's key that I make sure that the children of this country have a birth certificate, have an identity in the society.
So right now in Winneba, we are doing a 1-week workshop where 3 days will be involved in extensive training on the system. And that's our key focus, registration of fresh birth using mobile devices so you can reach out to areas that we've not reached to increase the percentage of fresh birth that we do register.
And for 50 of us to be selected to come here, it is a privilege. Those who are being trained today will learn what they are being taught, and they become useful in their areas of work.
Whatever we are going to learn here, when I get back to the office, all the people under my jurisdiction, I have to train them whatever we did here. I've had the opportunity to use the device a bit, so I know a little bit about it.
So this is a short training, you see, to choose the date of birth. In this particular case, the child was born when?
26 November.
Well, how old is the mother?
30 years.
30 years.
1985.
Okay. I think, obviously with change, people do worry. It's natural. And also the change will benefit them. It will make their work more efficient. It will also mean that they will be able to see the end result of what they are doing and know how important the role they are performing is. You see, these are all the information, the date of the time, everything, the last name. You can then send this straight to the registrar without having to type it out yourself. So they will just look up the code and see.
Looking at my district, there are places it's very hard to go. Sometimes when we are short of the forms, we find it very difficult to go to those remote areas and do the registration. With this mobile device, we can reach out to them.
It's a little surprise to the people because actually they normally see us with the forms. Right now they see that everything has changed, it's digital. So when they see, they rush in to register. They want everything to be done. Oh, what's the name? The child's name? Okay, wait, I'm coming.
It is the P step.
Come again?
The P step.
P? Ah, okay, the P, okay.
Actually, the birth certificate would have been done long time because in Kwalebu, we wanted to just do it when he was born. We were just contemplating as to what name should be given. So that became an issue. We could not use just a single day to think about it. That's why his own has delayed for some time. We are blessed to get it today. In fact, 7. Yeah, he's even happy, you know.
Whatever data they collect from the field, when they forward it, I can also view it here as a district officer without waiting for them to submit the forms. Since we are piloting it, the devices are very few here. But all in all, it's working very well.
You just interview the women directly and then I tap it on the tablet. It makes my work easier.
The registration, it was very fast. I didn't find any difficult when I was doing the registration.
What's the name?
Alfred, let me check.
That is all.
Yes, please.
Did you deliver by yourself or CS?
It was CS.
Okay. Most of the mothers, they've not been to school. Give me your house number then. If you don't know, you can call your husband.
For your house number 1.
Yes, madam. Please mention it for me. Okay. Thank you. Okay.
I can remember that my first son, 2000, they asked me to go and come. I think it was 1 week, 2 weeks before I came back for the certificate. Today is so special. They just gave me my certificate. The mothers, they come in their numbers. We are able to take a lot of information.
If everything is already, then I can forward it. After I had interviewed the mothers for the birth registration, I enter it in our register.
This is the vault for the Birth and Deaths Registry. This is where all the registers are kept, all the registrars across the country. With the new system, data will now come in soft copies.
Welcome to the server room of Birth and Deaths Registry. This is the back-end system for the entire database registry. We are currently running 4 servers. Myself and a specialist from UNICEF put together the whole infrastructure. So then it means that if there's any challenge, it is easy to fix it.
So the new system, it will benefit all. It's holistic. The system can be used both on the field and right here at the headquarters. If an applicant needs a certified copy of birth record, when the record officer walks into the archive and is able to locate the entry in the register, instead of completing this form and sending it to the computer room for scanning and verification, all the record officer has to do, he will input the data on the tablet and hit the enter button. And all this manpower can be saved and they may be deployed elsewhere to do other work.
The challenges that we are having is power issues. Once a while there will be power fluctuations, and for that reason you need to come and put off the server.
So we are taking care of that by developing an offline, online system, where once you are authenticated from the central server, with or without internet, you can register the event of a birth of a child.
So what it means is that if it's online, they can send it immediately. If it's offline, they will have to still collect the data, store on the tablet or on the laptop, and then send when the server is up.
The problem we have is you, after entering the data, you have to write the certificate, which delays the whole process again.
We plan next to be able to print the birth certificate when the mothers are there. So that's one of the future things we will do. But at the moment, we're focusing on capturing the data. The government will have access to real-time data. It's difficult to plan how many schools you need if you don't know how many children were born 5 years ago.
I tried to put the figures together yesterday, and between December 2015 till now, we have done 7,997 fresh births in 3 months. And this is 400 fresh births more than the same period last year. And I think this has really put us on the right track. I would like to thank UNICEF and Tigo very much for the support that they've given us.
Based on the successful pre-pilot stage, we are now going to extend this service to another 300 communities and health posts.
I look forward to the scale-up of this project, and we are going to be committed to work very closely with the team as we move forward. And if I look into our plans that we have for the next coming years, you can see that more and more rural areas will get coverage. So this will improve the way that this project will evolve in the future as well.
There's been a deliberate effort to target the areas with particularly low registration rates. So if we do that well, we hope that that will help to push the general registration rates of the country up. But obviously the idea is that eventually the system of automated registration should be accessible everywhere in the entire country.